Welcome, everybody. We're super glad to have you for today's session. It's hosted by Burrows Consulting. We've got a great interview lined up with Ben Holter, co-founder of IronScripts. Ben, we're really glad to have you with us today, and I'll let you take this opportunity to introduce yourself, and then we'll get started with the questions.
Yeah, thanks, Callie. Yeah, my name is Ben Holter. I'm a long-term pharmacist by trade, co-founder and CEO of IronScripts, which is a pharmacy management company. I'll tell you a little more about that here on this interview, but happy to be here.
All right.
Awesome. Oh, take it. Go ahead, Elizabeth.
No problem. So, all right, you introduced us to pharmacy. So tell us about what you do with pharmacy. And, you know, this is what people want. They all want to make money, have shared savings through pharmacies for their FQHCs, rural health clinics, hospitals. Can you explain more about that? Keep it simple for us non-pharmacy people. So,
Yeah, absolutely. So, we founded IronScripts because we just saw a big need for covered entities. Everybody wanted to open a pharmacy, like you said, right? And the reality is, it's a very complex business. It's what we do day in and day out. So we felt like we could really add value by offering our expertise. So we offer a full turnkey solution, and what that means is we really do everything. So from the concept of, hey, I think maybe we should consider a pharmacy. We'll do all the financial analysis for you, show you if it makes sense or not. I'll work directly with your designer or architect to locate the space, build it out, make sure it's an efficient pharmacy workflow, which is super important. And some that we've walked into, we're not designed that way. So we like to get in there at the very onset if possible to make sure it's laid out the right way. And our goal is to do all that, get you credentialed, get you open as quickly as possible, hire the staff, and then basically just do all the day-to-day operations. So in a nutshell, we want you to have the benefit of owning a pharmacy and all the good stuff that comes with that, without all the headache of getting it started, the compliance, the day-to-day operations. So we
okay,
provide a solution.
you said something that makes me a little nervous. You said hiring staff, and I know how hard it is to hire staff right now because I ran a health center just up until the last few months and even hiring my own staff at my team. So can you explain a little bit more about what would be required of me? Because I know hiring people is hard right now.
It is, and most health centers, if they don't employ pharmacists, which is, it's a totally different ball game. So that's why we do it. We provide all the staff, all the HR. If there's a staffing issue in the pharmacy, it's our baby. So we take care of all that. And there we work for you, but essentially the staff would be IronScripts employees. So that way, your HR department doesn't have to take care of that.
Okay. Okay. Good. Good.
Yeah.
That's a lot on me. And then will you kind of explain then the process and how this can help my patients?
Yeah, for sure. So, as far as patients go, I mean, really, the convenience of having a pharmacy on site, really helps with compliance. It helps with adherence. We also implement programs that help with that, like med synchronization. So that's one of our hallmark programs that a lot of other management companies don't do or offer or do well. We're very good at it. Most of our pharmacies, are over 50% of the prescriptions filled, are enrolled in our med synchronization programs. So what that does is essentially it makes sure that the patients can get all of their prescriptions filled on the same day every month. Um, Providers we work with at the clinics really like that as well, because it kind of streamlines refills. Their patients actually take the medications they're supposed to, versus having to try to run, to a chain pharmacy 3 or 4 different times a month to go pick up the medication. So we think that's super important. Of course, we also implement a delivery program on your behalf, if you're open to that, which we highly recommend, just to further, improve adherence, getting the patients their medication. A lot of patients just don't have great transportation or other barriers. So that's something that we have a lot of experience with, and we would implement that as well.
Great. And then how much space and what's the cost? What are the details? What do I need to make an in-house pharmacy make sense?
Yeah, for sure. So, um, that's always the first discussion is, if we look at the data, make sure that the financials all work, which honestly, I think out of everything we've looked at, maybe we found one that didn't really make sense yet until they added a couple more providers. But really, almost all of these are financially viable, and it's really just a matter of, I think it's difficult sometimes for the entity to really be able to analyze that themselves. It's kind of a hard, they don't necessarily know what the operational cost might be. They maybe don't know like what the the margins are on those prescriptions and how do you evaluate that. So that's something, just as an aside, that's something that IronScripts offers free of charge. We do an initial consultation where we'll just look at 12 months of prescribing data. We factor in what the potential refills are, what we would estimate to be your capture rate, meaning like if you fill 50,000 prescriptions a year, or write 50,000 prescriptions a year, like how many of those might we reasonably capture at the pharmacy? What does the revenue and the gross profit look like on that? Compare that to expenses, and we can really kind of come up with a model to see if that's a financially viable pharmacy model or not. I think, when we look at the space piece, we like about 350 square feet minimum. So the sweet spot is 500 to 600 square feet. But we actually are opening one next week in Lancaster, Ohio. And we're right at about 350. And the pharmacy works. It's small, but it's very efficient. We laid it out in a way that we saved space everywhere we could. It's kind of like the IKEA of pharmacies, I guess you could say. But it's going to work great, and it's going to be a great service for them to be able to offer. So yeah, 350 to 500, 600 is what we commonly see. The other thing I guess I would say is, the pharmacy itself does not have to be in your facility. It can be an off-site pharmacy. We're right now in the middle of helping one of our partners with an acquisition of a little independent pharmacy that's right across the street from their health center. Busy store. They fill a lot of the prescriptions from there already. Owners just looking to retire, and we're gonna help with that whole transition, and we're going to then manage that pharmacy for them going forward. But it's a beautiful store. It has a drive-through. It's right next to them, so that makes a lot of sense if that scenario exists. And we're seeing just across the country, more and more health centers and covered entities are actually doing that model. So it's something worth looking at if that perfect scenario exists.
And what are some other perfect scenarios that you love to see exist to make this happen? What are some other synergies that need to happen and everything like that?
Um, I think that I think it's not a terribly difficult thing to do to get one of these open and make it successful. I think from talking to some of the health centers that we work with and covered entities, there's bandwidth. They're doing a lot with little sometimes. So the idea of just even wrapping your head around like opening a pharmacy like this whole new project that most people, that's not what their focus is, right? It's providing healthcare. And that's where I think we add a lot of value in that. You can kind of just give us the keys, and in 6 to 8 months we're going to have a fully functioning operational pharmacy that's starting to generate revenue for you. So I think sometimes we look for too many perfect scenarios. I know we worked with a lookalike that had just got their status, and it's just we're 2 years in, and I mean it's added almost seven figures to their bottom line,
Wow.
and they couldn't have imagined that. But like I said, I mean the opportunity is huge, and I think a lot of entities, if they really understood that opportunity, they'd be falling all over themselves to open a pharmacy as fast as possible, and a lot have. But I think even understanding that opportunity is a challenge, and I get it. I mean, when we do an analysis, we're using all the data that we have from other pharmacies. So we know what your gross margin per script is going to be in a 340B pharmacy. But how would you know as a an entity that doesn't have a pharmacy, right? So I think sometimes it's very difficult to really analyze that opportunity. And I guess, a takeaway I would say is, we'll do this for you at no cost, even if you don't use this or we're not the right fit. If you're thinking about it, call me. Like, we're happy. We have this built out and we have spreadsheets and formulas to figure all this out. So it's not a huge lift on us, but we put a little work into it for sure. And we actually use your real data. So it's very accurate analysis. And it's just a service that we offer. And we know this doesn't work for everyone, but reach out. I mean, we're happy to do that, and just show you the opportunity that exists.
And if I did start, how long till I actually see some money?
Yeah, that's a good question. So depending on, I'll just kind of give you a quick like walkthrough
Yeah,
of
give
what.
me a timeline. If I said, hey, I want to do this kind of, and I have the space and
Yep.
some startup funds, what would be the timeline? So,
Absolutely. So, part of it depends on the extent of the remodel. In most remodels that we've been a part of, it's literally you've got two offices. We knock out a wall, we put a pharmacy pickup and drop off window in, either a sliding window or a roll gate that opens to like a counter. Um, we just did one 6 months ago, and the total remodel cost was around $30,000 to get that pharmacy ready to roll. So it's not a huge lift. But so basically, however long that remodel takes, we're something of that magnitude, you're looking at like maybe a month. And then from that point, we just dive in. So we'll do the all your licensure with the Board of Pharmacy, the DEA, the NCPDP, the MPI numbers, all that stuff. We really have to get all that done before we can start doing credentialing with the insurance companies, which is really probably one of the more time-consuming parts of it, to be honest. So we do that. There's going to usually be some on-site inspection with the Board of Pharmacy, the DEA. So you really have to have that remodel mostly done before they'll issue those licenses. And then we move on to credentialing. Of course, we have to develop policies and procedures. The DEA, when they show up, they're going to want to see your controlled substance policies. So we're kind of doing all these things simultaneously, kind of walking and chewing gum at the same time. And then, it's kind of a mad rush to do all these applications for your CVS Caremark, your Medicare, your Medicaid, your Express Scripts, your Optum, your Humana, all those contracts that we have to have. We like to try to open with at least 80% of the contracts live, because we don't want to turn people away and then they never give us another chance. So I know some other companies will just open with like Medicaid, and ultimately it's the health center's decision, but we really like to have more in place, just so we don't lose some customers that we never get another chance on. But you're looking at from the time the remodel's done, we have had most of our pharmacies open and operational, generating revenue within 6 months. So on most analysis that we've done, and in real life, we're seeing the pharmacy actually profitable by month 6. Our best was actually profitable in month 3. But you're gonna start having cash flow come in on day one when you start filling prescriptions. But the the return on investment for these 340B pharmacies is very, very quick, and it's very significant. It's definitely not the same as what we would see. It's definitely not the same as what we would see in a more traditional pharmacy model that does not have 340B.
And I mean, I can do this on my own, but so I guess my question would be if I'm a CEO of a health center or a hospital and I'm thinking, do it on my own or go with someone else, what would you say, good and bad? I know, of course, you're partial to one side since that's what you do, but go ahead and kind of tell me the benefits of both, because I know if I do it myself, I probably can maximize income. So,
Yeah, I mean, and I'm biased, obviously, but I do think that's a good question, and a lot of folks have done it on their own. It is doable, but I guess I'll just kind of go through and give you some of the benefits. I think that, or just some things that maybe should even be thought about. Whether you should do it on your own or use a management company. So I guess number one for me would be experience. our team's been doing this for over 20 years. It's what we do all day, every day. That's our sole focus. Retail pharmacy is very complex, lots of rules, regulations, compliance, and really, I think it's a business in which sometimes you simply just don't know what you don't know, and that can really lead to some serious compliance issues. And I think what we've seen in folks that have done it on their own, where they've run into some issues, is they'll go out and they'll find a pharmacist with a lot of experience. Maybe has worked at CVS for 20 years, great pharmacist, awesome with patients, but really just doesn't know a lick about how to run a pharmacy business. And had a whole team at corporate on the back end that's always done all those things that now he has to handle, or she. And that's a tough position, and that it's not that they're not a bad, or that they're a bad pharmacist, but I mean this is just a totally different animal. And then the other piece comes in, is continuity. I think that using a management company like us provides you that comfort of continuity, because what happens if that pharmacist stays for 3 years and then decides to relocate out of state, or gets another job, or has a health issue and can't be there anymore? Now this pharmacy is kind of fallen into the laps of the C-suite, and ultimately, I don't think any of them want to take on the complexity of running a retail pharmacy, and all the intellectual capital that came with that person that started it and did everything, and all the little stuff is now gone. With us, I mean, if something happens to me tomorrow, my other two partners are both pharmacists, and we have a compliance team, and we have the whole back end team that run our operation and our pharmacies. They're still there. So I think from a long-term perspective, it provides a lot of risk mitigation. And that's not to say that you can't do it. That's not to say that there's not entities out there that have figured it out that do a good job. I'm not trying to discount that. I do think that there is a bit of misconception on the cost savings. And the reason why I say that is, when you hire us, I mean, you really eliminate the need to hire a director of pharmacy, because there's a lot that happens on the back end to run the business. And if you think you're just going to hire one pharmacist that's going to be able to do all that plus fill prescriptions all day, most entity-owned pharmacies that do it themselves simply don't. They have to have a director of pharmacy plus dispensing pharmacists. And in some of them we've looked at, they may have two additional pharmacists that we wouldn't have if we were doing all the back end stuff. So when you start looking at the cost of a director of pharmacy or a pharmacist, you could be talking about really, really more money in your extra staff than what our entire cost would be for our management fees. So I don't know that in some cases there's really a cost savings, and I think that you also then are just limited to having one or two people making all the decisions, versus having a whole team that's looking at all aspects of your business. So I think that's sometimes a misconception. And then lastly, I guess I would say the benefit of using us is, we call it like our IronScripts network. So we have 14 pharmacies currently that we're operating. We have 5 more that we're in the process of opening. Fill over 1 million prescriptions a year. We make about $80 million a year in purchases through all those pharmacies from our wholesaler. So what we've been able to do is we've been able to go to the wholesaler and negotiate a really good buying contract for all the stores that we work with. That if you just go out on your own and try to contract with one of the big wholesalers, we've compared that pricing, and we're significantly better, which adds a lot of money to the bottom line, which we think is pretty big value working with us. And same thing across the board with all of our other partners, our software company that we would use, vials, labels, all those things. We utilize and negotiate better savings just because of our network. So I think that's another benefit.
Awesome. We have a question that came through in registration, and I think we've touched on it lightly, but
Yeah.
just to directly hit it. How much space is needed for an in-house pharmacy? And does it have to be in the health center?
Yeah. Happy to hit that again. Yeah. So, like I mentioned, we like to see it about 350 as a minimum, 350 square feet. We can definitely work with that, and we have a pharmacy that's right about that we are just about to open, and it works. We could probably work with 300. I probably wouldn't try to do it much less than that. 500 to 600 is kind of ideal. But yeah, that's kind of what we like to see. The other piece, uh, just to reiterate, is you definitely don't have to. It doesn't have to be in the facility itself. If there's a nice commercial location nearby that would make a good pharmacy, that could be leased and retrofitted. You still get all the benefits of in-house pharmacy. A lot of the nomenclature, they've actually tried to not call it in-house as much and call it entity owned because of that, because it is kind of a misconception that it has to be in the facility, but it does not. And as I mentioned, we're actually helping a health center right now purchase an independent pharmacy and transition that, and we'll provide the management for it. And it's a freestanding building across from the health center.
That's great. And then again, earlier you had said you had used an example of one of your clients you were helping out, but can you share any more success stories or just real world examples of how you guys have just improved access and revenue and
Yeah,
with in
absolutely. Yeah, yeah, for sure. One of our clients, they're a lookalike, had just recently got that status and had came to us. We had their pharmacy open and operational in about 6 months from when we signed the management contract. Um, they were they had 4 providers at the time, so very small, and they were they were in month 3 hit break even, and in month 4 we're profitable at the pharmacy level. And we've had that store open now for a little over a year and a half. And in their full second year now, they're on track to add over $1 million in savings to their entity. So I think it kind of they were not expecting anything near that. They wanted to open a pharmacy because they thought it could be good for their patients and provide a little bit of revenue. But I think the opportunities for some of your facilities are probably much larger than you even realize. In that specific facility, we've worked really hard on capture rate. We're getting close to 50% capture, so almost 50% of all the prescriptions and refills written, we're now getting at that pharmacy. We work really hard on that. A lot of some of the other management companies out there don't really do the hands-on management to do that, and that's our biggest focus, because ultimately that's going to drive the most revenue to your entity if we can capture more and more of those prescriptions that are leaking out. One other example I'll give you is one of the pharmacies that we're opening here later in June. Um, they they knew they needed a pharmacy. They're having some financial strain overall. Huge opportunity. This pharmacy is going to be really a lifeline for them. They just did not have the budget to do it. So one of the things that we offer, so that way they didn't have to wait or try to go out and find additional financing, is we actually finance the whole project for them. We made it super simple. We covered all the upfront costs, the startup costs, and then we're actually going to cover all the operational costs for the first 3 months. And then we basically are allowing them to start paying that back once the pharmacy starts positive cash flow and starts turning a profit. So essentially, we're taking that risk on the front end for them. We're very confident in our ability to make it successful for them. And we're going to allow them to then pay us back, as it becomes profitable. So we were able to, basically 8 months from that initial conversation, this pharmacy is going to be open and generating revenue. And it was something that they didn't even see as a possibility. So that's a pretty cool one for us. And I think it's really going to let that health center thrive.
Yeah, that's awesome. Yeah, that's a lot of confidence to say, yeah, you will make revenue.
Yeah,
So
we
we'll
we
find
just
that.
we yeah we've been doing it a long time. I mean, we just feel really confident in our ability to make these work. So
Yeah. Um, do you see any like emerging trends in pharmacy access for FQHCs and lookalikes emerging right now or
I think um, for those that utilize contract pharmacies, they're already aware that there just seems to be this trend of manufacturer restrictions, which just really continue to chip away at your revenue and your savings, right? So they just keep excluding brand name drugs, that you used to get savings on now, which is why there's so much interest in opening your in-house pharmacies, your entity-owned pharmacies, because everything you capture there is going to be eligible. So, that's I don't think that trend's going to change anytime soon unless there's some legislation to prevent it, which some states are certainly working on that, but federally it seems to just keep dying, unfortunately.
And then Jennifer Price asked a question in the chat. Do you offer telepharmacy services?
Yeah, so I assume you mean like remote pharmacy. If not, please follow up on that. But in states that allow remote pharmacy, so that what that would mean would be basically we could have a pharmacy where there would maybe be technicians on site, and then the pharmacist would be at like a main site, and they would be able to check the prescriptions remotely. I think I've heard it, called telepharmacy or remote pharmacy, either way. So
Yes,
I
that's what I
think that's
meant.
what. I'm sorry.
Yes, that's what I was referring to. Thank you.
Okay, thanks, Jennifer. Yeah, absolutely. So I'm based in Ohio, and Ohio actually just passed this legislation. So we're actually working with a couple potential partners right now to kind of do an analysis on what that looks like for a main site pharmacy, and then two other locations that they have. Probably not quite big enough to support a full-scale pharmacy, but certainly makes a lot of sense if you can do a telepharmacy option. So yeah, we definitely are capable of doing that, and think it makes a lot of sense in some cases.
All right. Elizabeth, do you have anything
No,
else?
I think this has been great and lots of things to think about. So, Ben, we appreciate your time. And you'll be able to, we'll share his contact information with this clip so you can reach out to him directly. Or as always, you can reach out to Callie and me at Burrows Consulting, and find us anytime. We would love to speak with you more about opportunities to get more money so you can continue to grow the services that are needed so much in your community. So, in the end, again, that's what we're all here for, is to do our little part to make the world a better place. So if we can do that by generating additional revenue through pharmacy, getting you more money on grants, getting you RHC or FQHC status to get you more money, that's exactly what we all want to do. So again, thank you everybody, and feel free to reach out anytime.